Stakeholders at a recent workshop in Abuja have highlighted several factors impacting budget utilization, consequently affecting reproductive health within Nigeria's healthcare system. One significant issue identified is the delay in fund disbursement from the Federal Ministries of Finance, Budget and Economic Planning, which hampers the Federal Ministry of Health and Social Welfare's ability to effectively execute its budget. Now, our correspondent Emeka Mako attended the workshop and filed this report from Abuja.
The Nigerian healthcare system is underdeveloped, especially at the local government level, and faces numerous challenges. Inadequate medical intelligence and the absence of functional surveillance system further exacerbates the situation, as there are no mechanisms to track the progress of relevant authorities. In response to these challenges, the African Health Budget Network organized a two-day workshop involving NGOs, young people, and media professionals. The goal was to develop a scorecard and strengthen accountability mechanisms for the implementation of Nigeria's reproductive, maternal, newborn, child, adolescent, and elderly health plus nutrition strategy for 2023 to 2027.
This two-day meeting, we are developing a scorecard to track progress, to hold government to account, to promote accountability and transparency within the government cycle. For example, the government has committed to improve family planning uptake and also family planning funding through a sustainable financing mechanism and also a basket fund between government and donor partners. The government has committed to release the Basic Healthcare Provision Fund of 2023 and 2024.
The chronic underfunding of Nigeria's health sector has made health advocates consistently criticize the federal government for failing to meet the Abuja's declaration target of allocating at least 15% of the national budget to health. Despite recent increases in health sector funding, achieving sustainable health financing remains a significant challenge.
It's important that there is an accountability mechanism, even to protect the government. Because enemies of government can come and say this plan not doing anything. That's where the civil societies can come and say independently, I don't agree with you. We saw this happening. We went here, we saw this happening. The maternal mortality was this, it has come down. The family planning penetration was this, it has gone up. You know, it is the scorecard of the civil society that is so independent that actually will confirm the wonderful what government is doing.
Despite Nigeria's strategic importance in Africa, she remains underserved in healthcare. This is particularly evident in rural areas where health facilities, personal and medical equipment are insufficient. Okpeyemi Piton, the executive director of the GEM Hub initiative, said the Nigerian health sector has one of the lowest capital budget execution rates at the federal level.
Civil society organizations are coming up with a scorecard to look at this progress, and with the findings of our scorecard, we will now be able to engage government to say, when it comes to family planning, you had said that 1% of the budget will actually, of the health budget, will go to family planning. Is that what is obtainable? We are going to ask governments, we are going to hold government. So this document is actually to engage governments at both national and sub-national level to say these are the commitments and these are the direction that has been spelled out. How far are you going? And with asking the right questions, we know that governments will actually also adjust in necessary areas in which they need to adjust.
The workshop underscored the urgent need of improved fund release mechanisms, better budget utilization, and robust accountability system to enhance the effectiveness of Nigeria's healthcare sector and ensure the successive implementation of the reproductive, maternal, newborn, child, and elderly health plus strategy.